It's 2025 and more than 5 years have passed since the beginning of the coronavirus pandemic. Can we say that the pandemic is over?
The pandemic might be over, but the effects of the pandemic might still be here. And when I'm telling this, I'm telling about the so-called long COVID syndrome that we still have in Germany, we still have in the Emirates when you have a second hospital, okay? And you also have here in your country. To support this assumption, or this, speak, I have to bring you the proofs that I'm right when I'm telling this fact, this issue. And the truth is that we have in Germany and also in Dubai lots of patients looking for our hospital in Germany, in Bavaria, for the treatment of this so-called long COVID. Long COVID means the patient had an initial infection of COVID during the pandemic, but had a second infection some months after the first infection, and since then they are fighting with the side effects of this infection. The infection, that means, is persistent, and we can document with virus presence in the body and also with side effects of the virus induced, as we all know, by the so-called spike protein, which is on the surface, which is fixed on the capsid of the virus. And this spike protein has tremendous side effects because he can influence different organs. It's not like a, let's say, common virus like herpes virus or varicella zoster virus or cytomegalovirus or Epstein-Barr virus, who are bothering only the nervous system. No, the COVID virus, okay, through his spike proteins, which are undocking the so-called ACE2, angiotensin converting enzyme 2 receptor, can enter every cell, every system, every organ. And this is the problem the chronic ill patients fighting with this long COVID, okay, they may have multiple symptoms affecting the nervous symptoms. Everybody knows the chronic fatigue the people are fighting with. They may sleep 12 hours, they wake up and they're still tired the rest of the day. They have memory gaps, they have concentration problems, they have short memory problems, okay? They cannot read 10 pages because after the first or the second 2 pages they cannot concentrate anymore. They may have muscular pains and weakness. They cannot climb the stairs, one floor. They cannot climb one floor on the stairs. They have cardiovascular problem like tachycardia or irregular cardiac rhythm. They may have increased pulse without any stress, okay? They may have the so-called postural syndrome. They stand up and they fall back on the bed when they try to stand up. They may have pains, muscular pains. They may have organic problems and organ pains, okay? So there is a very large, game of symptoms, profile of symptoms, which we never find in normal viral disease, as I told before. And this polymorphic symptomatology, we call polymorphic, several organs may be affected, okay, is very difficult to be identified by the practitioner when they are not able to make again the COVID diagnosis. That means to check the presence of the virus in the body and to check the presence, the chronic presence of high levels of antibodies against nucleocapsid and against spike protein. And this is, our big advantage in Germany and also in Dubai. We start by checking these parameters to see if the patient is still effective with this virus 1, 2, 3 years after the pandemic, okay, which we find in a lot of cases. Another problem is generally that many of them, they report they get the infection after vaccination, okay, meaning that the vaccine, as we in the meantime know, brought any protection against the disease. This is another story, but for long COVID, these are the main facts, and we have a lot of patients with long COVID in our hospital in Germany, in Bavaria, and all the treatments we are offering is paid by insurances.
Am I getting this right? The person gets infected and the body produces those antibodies against spike proteins. Is long COVID something like an autoimmune problem?
Long COVID, or let's say the primary infection with COVID may become a long COVID if the patient has a deficient immune system and is not able to eliminate the first infection, the first COVID infection, like he's eliminating a flu infection or the bacterial infection, okay? He's not able because his immune system has a low performance. And the low performance his immune system may have different causes, okay? You may have genetic factors from your mother and your father who also had immune deficiencies. You may also have a high toxic burden in the body from environment, like intoxication with organic compounds, like pesticides from the food, like phthalates from the cosmetics, like phthalates from the plastic bottles, or heavy metals from your amalgam fillings or for your crowns or for your cooking pots. If you cook in metal pots and you do not have the genes responsible to eliminate these metals coming from the cooking pot, okay, you are just accumulating these metals, and these metals are disabling your immune system and your nervous system, okay? So these are tests we are doing in every patient to see which are the side effects of a long COVID infection. So it's not only the problem we found the infection, which are the side effects are the second problem. I can tell you that long COVID, sometimes also repeated vaccination, is activating older infections. If the patient had a dormant herpes infection, Epstein-Barr infection with inflamed ganglions, okay, lymph nodes, cytomegalovirus or varicella zoster infection, all these older chronic infections are strongly activated by long COVID, as well as a dormant tumor metabolism can be activated by tumor cell or by high levels of spike proteins after repeated vaccination.
If a person is vaccinated against COVID with any of the vaccines available today, he can not only get COVID despite the vaccination, but can also get problems that are similar to the symptoms of long COVID, right?
Yes, ma'am. Yes. The vaccination, we know in the meantime, and there are more than 5,000 peer journals reports, as of best medical reports, okay, documenting the different side effects of a repeated vaccination. The repeated vaccination, where we see the side effects, is starting with the second, third, or fourth vaccine, not with the first one. People who get only one single vaccine, as Johnson at the beginning and so on, do not have such problems. But people who get repeated vaccinations 3 times, 4 times, sometimes 5 times, okay, may have side effects because of the chronic induction of spike protein synthesis in different cells in the body. Chronic induction means that the production of spike proteins is not restricted only for 1 month after vaccination, as you are having during a normal infection. Okay, you have a virus infection who may stay 1 to 3 weeks. Afterwards, the immune system is producing enough antibodies or activates its immune cells to eliminate the infection. Here we have a different situation because the synthesis of these spike proteins is continuing over years in the meantime, as you know from the current statistics. Over years, you may find in the body of people who got 3, 4, 5 vaccines, and especially specific strong vaccines like Moderna or like Pfizer, you may find high levels of spike proteins, okay, 3, 4 years after vaccination. And these high levels may also induce side effects as a long COVID. And that's why, if you want to differentiate between long COVID side effects and the spike protein after vaccination side effect, you need special tests.
Can this long COVID be cured?
The long COVID can be controlled, I will say. No. We have cases where we recorded a total normality of the antibody levels, and this we associated with the disappearance of the virus in the body after repeated tests. But for this, you have to understand what is important to how to induce such a positive, let's say, therapy, a positive effect. And to understand this, you have to understand how is working the COVID, okay, in the body. What kind of side effects he has when he enters the cells, okay? And our question is, how can we stop the entrance in the cell? How can we stop the generation of spike proteins once the virus enters the cells, okay? And how can we increase the elimination of the virus from the body? So there are different, let's say, strategies to bring the patient back to a normal life. But if you don't identify the presence of the virus, and if you are not starting any therapy, the infection can be over years and years. And I'm talking about these strong vaccines, as I said before, Moderna or Pfizer. There are other vaccines with significantly lower side effects, like the Chinese Sinovac or like the Sputnik from Russia. Very low side effects as compared with the stronger vaccine from United States. Okay, so these are here we have the chance by impeding the entrance of the virus in the cell. That means with some natural compounds, for instance, and I just mentioned here, anti-inflammatory compounds like curcumin, compounds like dandelion, who are impeding the undocking of the virus to the ACA2 receptor, okay? Or some let's say, old drugs like hydroxychloroquine or ivermectin and so on, who are also blocking the replication of the virus, who are also blocking the production of exosomes. There are small particles from the cell moving the virus from the cell outside to infect other cells, okay? These compounds are blocking such processes, reducing the virus multiplication, okay? And if you add also some immune stimulating support to increase your own immune cell activity, these therapies combined give a totally new life quality to the patient. He can come back to his normal life, he can come back to his job, and he is not tired 12 hours a day, okay, after sleeping 12 hours. We are bringing back to normal life.